Hi, my name is Croft La France, and this is my presentation for residency. I am a doctoral student in the higher ed section. So my working research question is, how do challenges that the English language learner nursing students encounter in the clinical setting impact their learning? With a sub-question of, in what ways can faculty members enhance learning for English language learners, nursing students in the clinical setting? So the clinical setting is where students apply their learning from class. It's when they really learn to be what it is to be a nurse. They provide direct patient care under the guidance of a faculty member. They interact with healthcare professionals, peers, staff, patients, and oftentimes this is the most stressful and oftentimes the hardest part of nursing education. There's a large amount of information coming from all sorts of different sources that we have to kind of break down and assess, make a decision, and that mistakes that we make with patients can cause harm or can be fatal. And so when I think of what do I love most about my job, I love to be in the clinical setting with students. So that's kind of what brought me to having my research question be focused on the clinical rotation. So how did I get to this point? Well, I'm definitely a qualitative person. I really want to hear the stories and the voices of the students. I'm checking my time to make sure I'm within the 5 minutes. And so I started with a completely different topic in the first class, and I had to really stop and think about what I loved the most. And again, it was clinical. And as a senior nursing faculty, who I think I'm pretty good at it, I thought, okay, what are the issues? And it's that we have students that get to the senior level and struggle and oftentimes fail. They can repeat a course once, and that's pretty straightforward across all courses. If you fail a course a second time or fail in a nursing program a second time, you're out. So then you have to start from the beginning. It's expensive. And so initially I started to think about how did they get to this point. But talking to faculty and reflecting, I had to start and think about who were the students that were struggling the most, and it was our English language students. And I kind of had this big aha moment that, we say that we change our teaching methods to best meet the students, and every student has an equal opportunity, but it's really not true. And that I really had to admit that I was part of the problem, that as much as I thought I was doing the right thing, I was not adjusting my teaching to meet the needs of English language learners. And I thought that if I, who've been teaching for 20 years and have thought I was pretty good at it, was struggling, I must not be alone. So that's where my story comes from. So the significance is that we know that the ethnic and racial groups are increasing, but we have a small percentage of RNs practicing. Attrition rates are increasing, graduation rates are very low. And why? Language, lack of belonging, bias and discrimination, classroom and clinical climate, cultural norms, and that includes nursing as its own norm. We are not necessarily always the nicest group to new people. So my plan, I'm qualitative. I want to hear the students' stories and perceptions. And so along with that, I want to do a participatory action research. I want it to be collaborative approach. I want to work with the students, and primarily because I want to hear what they think the challenges are. I want to hear what they think the most effective strategies will be. Their perception is much different than mine. As much as I can try to think of what they are feeling, I can never. My experience is very different from theirs, so I want them to be part of it. Data collection will be interviews. I plan to do a pilot study at my own school to kind of fine-tune my questions. And I want to do snowball method because this is kind of a hard-to-reach population because the bird is just distracting me and not counting this as time. I want to do snowball method because this is a hard-to-reach population, because these students may feel as though that if they give information, it will come back to them. So I have to be really honest. And I plan to use grounded theory, and so that my theory will be derived from the data and the students' comments and thoughts and feelings. And so my goal is to provide equal opportunity for students. And so just as a fine aside, I did get verbal consent for this picture. And that I just wanted to give kudos. We asked if any students wanted to work during the COVID crisis that were senior evening students, and the only two students out of an entire class who volunteered were my two ELL students, who are now in the process of taking their boards. So kudos to them. And thank you very much. I think I'm right at the 5, and say good night, good afternoon. Bye all.